If you've ever had those relentlessly itchy, watery, red eyes, you know just how maddening it can be. Well, in this explainer, we're going to get to the bottom of what's causing all that irritation and, most importantly, walk you through a super clear plan to finally get some relief.
It's the question we all ask ourselves, right? Especially when allergy season hits. That crazy itchiness, that redness, it's basically your body's alarm system, screaming that something's bugging it. And trust me, if this is you, you are definitely not alone. It's an incredibly common reaction. So the official name for this whole mess is allergic conjunctivitis. Let's just break that down real quick. Allergic is easy. It's triggered by things like pollen, dust, or pet dander. And conjunctivitis is just the medical term for when the conjunctiva, that thin, clear membrane covering your eye, gets all inflamed. But you know what? The most important word on this screen is manageable, because it absolutely is. Okay, so here's our game plan. First, we'll nail down what this is and what the signs are. Then we're going to jump into a step-by-step treatment plan. After that, some really important cautions you need to know. And we'll wrap it all up with the key takeaways for relief. Let's do this. First up, what is it and what are the signs? You know, it's actually really helpful to understand the difference between the symptoms, that's what you feel, and the clinical signs, which is what a doctor actually sees. Let's talk about what you're probably feeling. The number one telltale symptom is that intense, undeniable itch. You'll also likely get a thin, watery discharge. We're not talking about thick gunk here. That usually signals an infection. It's also way more common if you already have other allergies, like hay fever. And a big clue, it almost always affects both of your eyes at the same time. So, when a doctor takes a look, they're searching for specific clinical signs. They might see chemosis, which is just a fancy word for swelling on the surface of the eye, or notice your eyelids are edematous, puffy and swollen. They can even spot tiny little bumps called papillae under your eyelids. And here's a key differentiator. They'll check for a swollen lymph node right near your ear. If it's not swollen, that's a huge sign pointing toward allergies instead of an infection. All right, enough about the problem. Let's get to the good stuff, the solution. We're going to walk through a clear, step-by-step treatment plan to get you feeling better fast. The approach is really built on 4 main pillars. First, we have to start at the source and get rid of the trigger. Second, we use cool compresses for some simple physical relief. From there, we bring in medicated eye drops, and for those more stubborn cases, oral antihistamines can be a huge help. Step 1 is the foundation for everything else, and it's so important. Get the allergen away from your eyes. It sounds obvious, but it's crucial. Think about it. Pollen can cling to your hair and clothes all day long, so something as simple as washing them more frequently can make a massive difference. Next up, for that immediate, that feels better moment, turn to cool compresses. Seriously, a clean cloth soaked in cool water, placed over your closed eyes for just a few minutes, is amazing. It helps reduce that swelling and calms down that maddening itch. You can do this a few times a day for some really simple, drug-free relief. Okay, step 3 is all about the eye drops. But this is not a one-size-fits-all deal. You've got to match the treatment to the severity. For just mild irritation, simple artificial tears used pretty often can be enough to just flush out the allergens. For more moderate cases, you'll want to grab over-the-counter drops with an antihistamine, like ketotifen or olipatadine. And then, for severe symptoms, a doctor might prescribe a mild topical steroid for a short time. So what if the eye drops just aren't quite enough? For those moderate to severe cases, that's where step 4 comes in, adding an oral antihistamine. This can give you relief from the inside out. You're probably familiar with common options like diphenhydramine or loratadine. They work systemically to calm down your body's overall allergic reaction. All right, we have our plan, but it is just as important to use these treatments safely. So let's cover a couple of crucial cautions and talk about why following up is so key. This is a big one, so listen up. Routine use of topical antibiotics or steroids is discouraged. Why? Well, antibiotics do absolutely nothing for allergies, 0. And steroids, while they're great for severe inflammation, carry risks and shouldn't be used casually or for a long time without a doctor's okay? And just to be crystal clear, on steroids, think of them as a special tool for a specific job. They are reserved only for severe cases, usually for just a week or 2. And they always require medical supervision. Your doctor needs to watch for side effects and will tell you exactly how to taper off the dose slowly. So, how long should you wait to see if the treatment's working? The magic number is 2, as in 2 weeks. The recommendation is to follow up with your doctor in 2 weeks to see how things are going and make any adjustments if needed.
Whew, we have covered a lot of ground, from the causes all the way to a full treatment plan. So now let's just boil it all down into a simple, memorable action plan.
Let's put it all together. Here's your action plan. First, always try to get rid of the trigger. For mild symptoms, stick with the easy stuff, cool compresses and artificial tears. If it's more moderate, grab an over-the-counter itch relief drop. But for anything severe, or if you think you might need steroids, it's time to see a doctor. And no matter what you do, check in on your progress after 2 weeks.
So now you have the info, the power is really in your hands. Whether it's just trying a cool compress later today or picking up some different eye drops on your way home, think about it. What will be your first step toward getting some relief and taking back your comfort?